Hello my friends, in this video we are going to be learning and talking about the pelvic floor, the movement of the pelvis, and breathing and the relationship between all of these things. So it's all about pressure in the abdominal cavity. So we have our diaphragm, our respiratory diaphragm, and our pelvic diaphragm, or our pelvic floor. And these, I talk a lot about how these are meant to work together to manage the pressure inside the abdominal cavity. So as we take a breath in, what happens is, as the oxygen comes in, that diaphragm, of course, I talk a lot about the ribs moving out, but that diaphragm also moves down. As the diaphragm moves down, that pelvic floor then experiences that load, and as we exhale, comes back up. And so we hear this a lot in social media and different things. This is kind of like level one of the knowledge of that relationship. And we can peel back the layers and go even a little bit deeper than that. And that's really what BRM is about peeling back those layers slowly as ready to learn more and more about this. So now let's look at the second layer of knowledge with breathing and the pelvic floor and the movement of the sacrum. And so we want to have not a too tight pelvic floor because that won't allow this movement. If we have a too tight pelvic floor that can't kind of be that trampoline responding to that pressure and coming back up, that's when things can happen like we leak urine. Maybe you jump, if that trampoline doesn't have that spring, it can, maybe something's released. We need to get that pressure response somehow, and if we can't be springy enough to respond and then rebound, maybe we lose urine or something else happens. And so let's look at actually what's happening with that springiness. When we have that mobility in the pelvic floor, that also goes along with mobility in the sacrum because the pelvic floor is literally attached to that bone. And so if the pelvic floor is too tight, we are going to have limitations in mobility here, which is not optimal for life, but it's also especially not optimal for childbirth. So now let's add the breathing. So I'm going to do a very rudimentary pelvic floor. Of course, there's many different muscles, but let's imagine here's that pelvic floor attaching kind of from the back to the front. Now, as we inhale, remember what happens is there is more pressure in the system. As that diaphragm moves down, that pelvic floor now needs to experience that load. And so what happens is some more of the abdominal contents are going to come into the pelvic cavity, and what's going to happen is called counternutation. So it looks like this. So that pelvic floor experiences that load, and we get a lengthening load to the front of the pelvic floor and maybe a shortening load to the back side of the pelvic floor. And now as we exhale, now remember that pelvic floor is going to lift and that diaphragm is going to move back up, and how we do that is like this. So here's that inhale, and now exhale. Inhale, exhale. So in addition to that pelvic floor moving down and up, what's also happening is that sacrum is getting a gentle move as well. And this is one reason why as we exhale to push, this is actually great. You can hold your breath and push and use pressure, or you can exhale and you actually are creating more space as you exhale to push. So pretty cool, right? So follow along for more tips and we will continue to peel back those layers of awareness.